Today is a day that Northeast Texas Public Health will have an announcement here in a minute, but I want to also thank all the people that are here from our healthcare and our emergency preparedness group. We have planned for this day in this community for weeks and weeks. So I want to thank all of the professionals that are here and all the great work that you're doing at your hospitals, EMS, the county organization, our fire chief who is helping coordinate our efforts. We just have such great people in this community that are involved in this project, and I want to thank each and every one of y'all before we get started today. And many of them will be coming up speaking to the public as we go through today. But at this time, I'll turn it over to George Roberts, who is in charge of Northeast Texas Public Health. George?
Thank you. Thank you, Mayor Hines. Good morning, everyone. Again, I'm George Roberts. I'm Chief Executive Officer of the Northeast Texas Public Health District here in Tyler. What I want to share with you today is that we have 3 confirmed cases of coronavirus here in Smith County. All 3 of them have recent travel history, traveling outside the United States. All are currently under medical monitoring, and one of the individuals is in serious condition. And I will share you more. Your question is going to be, where are they, who are they, male, female? Quite frankly, we can't share that right now because it is protected information, and those individuals have not given us the ability to say that, to answer those questions. So if you ask that, I'm sorry, I'd always like to be upfront with the media and tell you, but I can't tell you that information today. So what do we want to, we're going to share with you, we have several people who work in this community, I think have some great information that you need to hear about, and please share this with your viewers, because again, the media is, you are so important to get the message out, and this is a challenging time for our city, our county, our state, and our country, and our world, quite frankly. And we need you out there telling good, the solid information out there and what people can do about this themselves, because we can do a lot of things, we can say a lot of things, but ultimately is individual responsibility to watch yourself. So saying that, what are the symptoms? You know, we've talked about this, but I think it's something we need to talk about and talk about and talk about again and again and again. The symptoms are a fever, and the fever in this situation is not overly high. Sometimes it can be real high, but typically it could be 100 to 102, which is not considered high fever. A cough, shortness of breath. And so those are kind of some initial symptoms you would see, and typically they come on 2 to 14 days post-exposure. So what can each of us do today to try to limit the spread of this in our communities and ourselves? So number one is, let's talk about yourself. And I've talked about this on many, many occasions here, is wash your hands with soap and water for 20 seconds or more. You know, I know that's been a challenge for, you know I call myself always washing my hands in the past, but since all this came about, I think my hands are getting a little more chapped now, because that's something that we really need to do. Wash your hands for 20 seconds. If you don't have soap and water to be able to wash your hands, use a hand sanitizer that has at least 60% alcohol base in it. Avoid touching your eyes, your nose, and your mouth. Keep your hands off your face. And that sounds like an easy thing to do, but how many of y'all have a hard time with that? And I won't ask, the cameras aren't showing the audience, but just about everybody's raised their hand or nodded their head in agreement. Social distancing. That is the one thing with this virus that's been so interesting. And then basically we're saying social distancing is roughly 6 feet away. And why do we say that? Because if I were to cough or sneeze, there's these gentlemen and young lady in the front row here that I think I'm far enough away I may not hit you. But typically your cough or sneeze goes that 6 feet. If you keep that distance further than that, then you have the ability maybe not to catch somebody's cough or sneeze when somebody does it. And we also want to encourage people to, this is on our own too, when you have to sneeze, do it in your crook of your arm or something like, some semblance of that where you're covering it. Cover your cough or sneeze. Clean surfaces, disinfect surfaces. There's plenty of cleaners out there on the market. They say it's good for the flu. Basically, you're wanting to just clean your surfaces. And finally, cities, as Mayor Hine mentioned, cities, municipalities, statewide organizations, national organizations are making pretty tough decisions right now about how do we deal with larger group gatherings? And you're seeing a lot of people making a decision to pull back on that. And the idea is that if we can limit the exposure for people, then perhaps we can get through this thing with less trauma. So wash your hands, avoid touching your eyes, nose, and mouth. Social distancing, 6 feet or more. Cover your cough or sneeze. Clean and disinfect those surfaces, and really pay attention when the cities and municipalities or your own organization needs to potentially look at an event. Determine who's going to be there. The primary people who get this really can potentially harm are people over the age of 60 and with chronic medical conditions. So those are your big folks that really are touched by this. So a younger person, here's why they say maybe, well, younger people, here's why they kind of say that, is that if a younger person goes home and maybe grandma or grandfather is there, potentially they could expose them and potentially cause them harm. So that's one of the reasons why we're talking about this whole issue of looking at the large gatherings. At this point, I'm going to call my friend Dr. Jeff Levine, who is Smith County Health Authority and the regional official for the Public Health Lab of East Texas. Dr. Levine?
So thank you, Mr. Roberts and Mayor Hines, and certainly to the media for being here. As I think I mentioned to many of you yesterday, you play a very important role in communicating and informing and educating the public, because a lot of what we're talking about really is what the public has to do as opposed to what the health community actually has to do. It's really important as a part of the responsibility of the public to try to follow the guidance that's being given by the medical and the health community. I'm going to keep my comments very brief this morning. I only want to speak to just a couple of issues in terms of what my role is in working with Net Health and Mr. Roberts and his entire team. And that is, as the local health authority, I work with them to help craft best practice recommendations that individuals should actually follow. I try to help make sure that message really is based upon best evidence, either emanating from the Centers for Disease Control, World Health Organization, or any other recognized authoritative body. The other thing that I do with them is I work with a number of individuals in the health department in the process of contact investigation, and I'm not going to you're going to hear in a minute from Mr. Hopkins, who will tell you a little bit more about exactly what contact investigation is. And then finally, as Mr. Roberts mentioned, I'm the responsible official for the Public Health Laboratory of East Texas. And in that role, I coordinate between that laboratory, the Northeast Texas Public Health District, the Department of State Health Services, in making the limited capacity of the only available testing that we have right now for coronavirus in Smith County in Northeast Texas, to prioritize the tests that need to be done so that they can be done expeditiously, reported back to the medical community, and certainly to the health department and all of the individuals that were required to under state and local requirements in order to make sure that everyone has the necessary information going forward in terms of next steps with care or next steps in terms of individuals who may have to self-quarantine, those sorts of things. So really those are my roles. I take them very seriously, and I want to continue to be very open in answering whatever questions you may have relative to those specific roles.
Thank you, Dr. Levine. Next up is the Northeast Texas Public Health District Director of Public Health Emergency Preparedness, and he's going to come talk to you about contact investigations and also preparedness. And as Russell's coming up here, one of the things that we talk about in public health, a lot of time our work is, shall we say, invisible. You know, we're doing lots of different things around the community, such as food and restaurant inspections, doing vaccines, the work Russell's going to share with you. And when things are going well, our work falls under the radar screen, which is okay. On the other hand, at times like this, our work is not quite as invisible. So, Russell Hopkins.
Thank you, George. As he said, my name's Russell Hopkins. I'm Director of Public Health Emergency Preparedness and Disease Surveillance. And the first topic I'd like to cover is our efforts in contact tracing and what that involves. As George said, we do have the 3 positive cases, and we know that they have contacts that have been exposed. What our epidemiologists do is get in contact with them. We run through an algorithm that determines their risk, and then we base that risk on what our advice to them is. So our advice may be go about your business and watch yourself. Or it may be that we ask you to self-isolate and then report your temperature and physical conditions. So while it is not a legal requirement, that comes around if we don't get somebody to comply with that. A control order is put on those folks, and they are required by law then to follow the directions of the health authority. Contact tracing goes on every day at the health district. My epidemiologist currently, in addition to the coronavirus response, still have the Shigellas, the Salmonellas, the vaccine preventable diseases that come across our desk every single day. So we are quite involved with coronavirus, but we still are maintaining that level of protection in the community for the other diseases that we know are out there. Secondly, I would like to talk about our preparedness efforts and what has been happening since in January. We have been talking to city, counties, in the jurisdiction that I have, that is 7 counties around Smith County, and school districts, long-term care facilities, daycares, superintendents, universities. We've done preparedness exercise in the form of tabletops where we talk about policies. So we believe the community is ramping up their preparedness, and we really want to stress how that's done for the public. It is not pandemic panic for you to isolate yourself or to reduce the amount of exposure in your community. It's a wise decision, and it, quite frankly, is the only one left to us once community transmission begins. So when you see officials closing events or services, understand that is aggressive means of managing this disease and the spread of this virus. And that's all I have. Thank you.
Thank you, Russell. Our next 2 speakers, we're very fortunate today. I have our hospital partners here today. And our first gentleman is Dr. Mark Anderson, who's the Chief Medical Officer for Christus Trinity Mother Frances. Dr. Anderson?
Thank you. As George said, I'm Dr. Mark Anderson. I'm the Chief Medical Officer for Christus Trinity Mother Frances. I want to let you know that Christus Trinity Mother Frances, as part of the Christus Health System, has been actively monitoring and planning for COVID-19 in our communities. We work hand in hand with our local public health departments, whether it's local or state level, ensuring that our personnel and associates physicians fully understand CDC guidelines and public health guidelines around treatment and infection prevention. Infection prevention is something we do every day in our hospitals and clinics to ensure that our patients are safe when they enter our facilities. Whether it's having to do with influenza, simple coughs and colds, infection prevention is something that's standard practice for us, and COVID-19 does not change that. All our associates are well trained, we're prepared for this, and our hospitals will be and continue to be a safe place to provide care in our communities. The things I tell our community, same things I tell my family. How do you prevent transmission of disease? You wash your hands frequently or clean your hands with alcohol-based cleaners. Don't touch your face. Ensure that when you're in public places that you clean surfaces around you. Try not to gather in large groups. Provide some social distancing. And ensure you try to protect yourself from transmission of disease. This is the same we should do for influenza, for common coughs and colds. Don't come to work when you're sick. Don't send your children to school when they're ill. We're prepared for this in our communities. We're looking forward to working with all of our healthcare facilities, with the public health department. Christus Health, our mission is to extend the healing ministry of Jesus Christ. Our associates do this every day on the front lines and embody that mission in our communities. We're here to serve, protect, and care for our citizens and all of our patients, and look forward to doing so. Thank you.
Thank you, Dr. Anderson. Next up is Dr. Tom Cummins, who's the Chief Medical Officer for UT Health East Texas. Dr. Cummins.
Thank you. As George said, I'm Dr. Tom Cummins. I'm the Division Chief Medical Officer for UT Health East Texas, so covering the wide span of our 10-plus hospitals and ERs. We too are very committed to continue to care for the people in our communities. We've been monitoring and planning for these events for a number of weeks and months. We have isolation areas and protected areas for our patients to keep them safe as well as to keep our staff safe. Our staff have been drilled and trained on how to protect themselves and to protect other people who come through the doors, to provide as much safety as we can to those folks. We've worked in all of our facilities from east to west, north to south, to be sure that our folks are prepared. We have fantastic caregivers who are dedicated to providing the best care they can to our folks. EMS has also been prepared and prepping for these kind of events as well. We're going to continue to be there. We're going to continue to be open. Our clinics are prepared for you. We have places for our clinic folks to present, as well as our ERs and other facilities to safely manage and care for them. In fact, we encourage our patients to call our physician referral line 596-DOCS, and they can direct you to the best place for care going forward. So we're going to continue to do the things that we're supposed to do to take care of our communities. Thank you.
Thank you, Dr. Cummins. We also thought it'd be very important this morning for you to hear from EMS. So we have John Smith today, who's the CEO of the UT Health East Texas EMS system. John?
Like I said, I'm John Smith, CEO for UT Health EMS. Just going to give you a brief how we're responding to this incident. We're working very closely with our first responders. We've been having conference calls. We've had a joint plan put together for a while now. And we've had our communication center for over the last month. We've been screening our 911 calls for signs and symptoms. As that information updates, we update our questions. And what we've also been working with the health district for patients that are under investigation. We have alerts in our computer system that will alert our first responders and EMS that could be a possible case when we respond. What we want the public to know is if we see signs and symptoms, you may see our people come in with protective equipment on. They'll be wearing a mask and a gown. They may ask you to put on a surgical mask. This is out of an abundance of caution, but you may see that as we go out there. We've also worked closely with all the local hospitals. We've had phone calls with UT Health. We've had phone calls with Christus EMS to make sure once we arrive at the hospital with a suspicious patient, we transfer there in an appropriate manner. So I think EMS has been working with a lot of partners, a lot of first responders, fire departments, hospitals. I think we're well prepared, and I'm comfortable with the communication we've had.
Thank you, John. The next two individuals are going to be the folks who handle our emergency management coordination. And our first person to hear from is the Smith County Emergency Management Coordinator, Jay Brooks, who's also the fire marshal. Oh, Commissioner Ward's going to, oh, good.
Thank you, George. As George mentioned, Jay Brooks is the Emergency Management Coordinator for the county. On behalf of County Judge and the rest of the Commissioner Court, I want to thank the Mayor, the Health District, the hospitals for the efforts that they're putting forward. We do have a couple of announcements, and Casey Murphy is also here. Y'all know Casey. She'll be sending out further information today. At this current time, all county offices are open. We're just asking for people to consider if you need to renew your tags or pay your taxes, something like that, to do that online, just to ensure more social distancing. Don't come in if you don't absolutely have to. We will be anticipating there will be some change to jury selection. That final decision will be made today after consultation with the different judges. There's courts set, obviously, for this upcoming week, but would anticipate that those not jury pools being called in at this time, but Casey will communicate that to you later today. Other than that, I just want to thank everybody who's worked over the last week and a half. We felt like this would ultimately happen, it has, but we're in a very good position to be in. We have good communication with all our health partners, and I feel like we're able to address these issues as they come up. So I'm going to let Jay address anything else that he may have. Thank you.
Thank you, Commissioner Ward. Just want to assure the county that we are prepared for this. This is nothing new. We have been preparing. We've got some great partners. I'm just going to just echo what's already been said. We're working really well together, and we do have a plan, and we're going to take care of the community, and that's our job. And so thank you for everything everyone is doing.
Thank you. Thank you. Thank you, Commissioner Ward and Chief Brooks. Chief David Coble, who's our City of Tyler Fire Chief, as well as the City of Tyler Emergency Management Coordinator. Chief Coble?
Thank you, George. Just as everyone else has already said, the City of Tyler is preparing and prepared to respond to your needs each and every day. We have modified, as you heard from EMS, we've modified our procedure on how we go out whenever there's a call for help at your house. You call 911. Those procedures have been in place for a few weeks now, so we have been preparing for this. Along with that, we plan to have a limited activation of our EOC starting on Monday, March 16th. It will be for a level 3 limited activation, and it would be for coordination purposes. But in lieu of actually having everyone come in, we're working with our IT department so people can call in as well, so that the information can go out without everyone congregating every day at the same time to get the information. But we think it's vitally important that we all get on the same page here in the city and also with the county, that we're all walking in step so we can all see our way through this incident. In addition to that, the city will be releasing a press release showing some modifications and some of the services of the city that will follow this press conference. The press release will follow. And if you are feeling something other than your normal allergies this time of the year, please give your primary care physician a call and go and see them and follow their directions. Because if you don't need to call 911 after it's gotten really bad, maybe you can already figure out what's wrong earlier on in the process. So thank you.
Thank you, Chief. So before we take questions, just to kind of some summary points here. Chief Cole just mentioned, if you think you're sick, if you're running some fever, if you have some issues, in this season we're in right now, please call your provider first so they can have some type of knowledge that you're coming. And if you have a respiratory thing, maybe perhaps you may have been exposed to coronavirus, it's good for your provider to know that before you show up at their doorstep. So please do that. Again, for your personal precautions, we've talked about a couple different times here. Wash your hands with soap and water for at least 20 seconds. If you don't have soap and water readily available, use an alcohol-based sanitizer with 60% alcohol. Avoid touching your eyes, nose, and mouth. We talked about social distancing in here, 6 feet. Cover your cough and your sneeze. Clean and disinfect your surfaces. We mentioned it too, stay home when you're sick. That's one of the things we can do to try to keep the spread of this down. And also try to stay away from sick people as much as you can. At this point, we're ready to take questions.
George, what do we know about the 3 patients?
Well, we do know about those folks, Blake, but again, I'll say it again. We know that 3 cases had recent travel history outside the U.S. They are all under medical monitoring right now, and 1 is seriously ill. And again, for HIPAA reasons and privacy reasons, that's all I can really say right now.
How much interaction have these 3 people had in the community?
Russell, can you answer that, or Jeff, can you answer that?
Well,
You'll come up here. Yeah.
So the question was, how much interaction have the confirmed positive individuals at this point had in the community? That actually is part of the contact investigation that is currently underway. That has been started. It takes a little bit of time to gather all of that information. And so really I don't have absolute details on that, how many contacts there have been, where they've been, that sort of thing, all of that is currently being conducted by the epidemiologist in Net Health.
Were they going about their daily lives before, being tested and confirmed positive?
Well, to the extent that I'm aware, yes.
Were they treated in Tyler, or did they come to Tyler for treatment?
To my knowledge, they've been treated in Tyler.
Do we know what hospitals?
I'm really not at liberty to talk about that at this point.
Other questions? Yes, sir.
Do we know where they traveled to?
Yes, we do. Again, we can't, that's information we're not releasing right now.
Was it all the same place?
No.
Were the cases connected?
Yeah, 2 of them are.
So, we know that the person in Grady County was treated at Good Shepherd. Can you at least tell us which hospital system they were treated at?
Yeah, that's a good question. That person had released that information, so we had to sign consent form to release that information. These 3 individuals have not done that. That's why we can't answer that question.
Were their test samples handled at the Tyler lab or sent to like Atlanta?
Dr. Lee?
I apologize, the question was, were the test samples handled at the Tyler lab, or were they sent to Atlanta? So all 3 of them were handled at the Tyler laboratory.
Was this from the original batch tests that were conducted? The time that you were talking about yesterday?
So yes, original batch. The original large batch was first performed yesterday.
So, you can't tell us who or where they had contact. Can you tell us if the contact is more than 10 people, more than 20, if they've been out in grocery stores? I mean, I think the community's pretty concerned about that.
Can you answer that, Russell?
So the contact tracing is not over. In 2 of these individuals, it's going to be wrapped up very quick. Another one will take some time. I personally do not know the exact numbers, as my epidemiologists are working that issue right now. So it's probably changing by the minute.
Can you guys commit to releasing that as soon as you have a ballpark figure for us?
I won't commit to it.
When were each test, the samples tested?
When were they tested?
I guess kind of a 2-part. When were the samples obtained, and then when did the results come back?
So the question is, when were the samples obtained, and when did the results come back? So the samples were, to my knowledge, received yesterday morning in the FLET lab, and they were processed yesterday as part of this large batch that I mentioned, and the results were resulted late yesterday afternoon, early evening.
Did you say how many people were in that batch?
I believe we had 20 yesterday.
And then just 3 tested positive?
That is correct.
Are any of the people that are part of this contact tracing, will they be tested?
Questions to Russell.
So the question was, will any of the contact tracing people that were identified be tested? It's quite possible that that will happen. When we contact these people, we assess their risk and make a determination on should self-monitoring be fine, should we send them to isolation, or should we bring them in for testing? So it's possible that they would be tested. It would also be possible that we ascertain no specific risk and allow them to go about their business.
Did you already say if they were quarantined, like at home or at a hospital? I'm sorry, I know you said one is in bad shape.
Yeah, we basically said they're all three under medical monitoring. One is was seriously ill.
And quarantine is a legal device that we control their actions, prevent them from access to the public. So there are no quarantines in either Gregg or Smith County.
The 2 cases that are connected, is that a couple?
We can't say.
When were they taken to the hospital, do we know? Earlier in the week, yesterday?
I think that would have to be released by, or permission released by the patients.
Now, again, we hate to be vague, but again, through the HIPAA laws and things, we can't. I know you want to answer, and it's something we can't answer. We're not allowed to answer that question right now. But we are allowed to tell you, here's what here's what happened, that we are allowed to say they had recent travel history outside the United States, and that, you know, they are under medical monitoring, and one is seriously ill.
So, just again to ask, where are they right now? Are they at home in isolation or?
We can't, I'm sorry, Blake, we can't answer that. Yes, sir, Hank, you got a question?
Yeah, if you have to be tested, where would the test actually happen? Would it be in your doctor's office? Would you travel to the lab? What would?
I'm going to ask Dr. Levine, can you?
So the question was, if a test were to be undertaken, how that would happen, where a person would travel, that sort of thing. So the medical community would normally secure that test, and then arrangements would be made to send that test in a carefully packaged and controlled manner to the Public Health Lab of East Texas. It's there the actual testing of the sample to determine whether it's positive or negative actually goes on.
So we've got a crush of missionaries and vacationers coming back just because we happen to be in spring break. What is the best procedure for them if they're concerned about their travel history?
Sure, the best procedure would be to, if they're concerned that they have the symptoms of, you know, again, fever, cough, shortness of breath, to go to their medical provider. And in that situation, to please let their medical provider know in advance that they're coming. Other questions?
So the two of them are connected, one of them is not.
Correct.
All the test samples were received at the same time.
They were done at the same, they were actually all run yesterday.
So the question was, were all the samples that were positive received and run at the same time? And the answer to that is yes.
But not connected, that just happened to be the case.
Correct. Other questions?
We tested 20 in that batch. Was that the first batch of people in Smith County that were tested?
Well, he can speak to the lab. I'm not sure he can tell you exactly if it's Smith County related. Well, they may not be all be Smith County, Alan, but.
So I neither have committed to memory the exact locations where all of those test samples came from. But I will say that those were all the ones received in this first batch yesterday that were actually tested. The lab has been able to stand up the test since Monday, and so there was a test or two that has been done since Monday, but this yesterday's batch was the first one that revealed any positive test.
Do you have any idea how many total tests have been done in the Tyler lab?
Between 20 and 25 at this point.
And of those, 3 positive?
Correct. That's correct.
Y'all mentioned a bunch about telling your health provider before you go to see them. Many people don't have them. They show up at ERs. They show up at the hospitals. What do they need to do if you don't have a regular doctor that you can rely on to talk to? Who do you inform?
Sure. I'm going to ask Dr. Anderson, Dr. Cummins, if y'all could address that. That's an excellent question. Dr.
Yeah,
Yeah, that'd be a great.
So, please, go ahead
So
first.
I think from my perspective, I would say if they don't have a local provider and they feel like they need evaluation and treatment, contact an urgent care center so to make arrangements to come in and be evaluated. Or if not that, then the emergency room, but call ahead. If we know that you're coming before you get there, we have a much safer process for getting patients into the emergency room, protecting the staff, protecting the patient, protecting the other patients as they come through. So I think urgent cares are a fine place to go as a first start, particularly if you're mildly ill. Obviously, if you're seriously ill, we'd like you to come to you will need to come to the emergency room, but as much advance notice as we have before that, the safer it can be for all parties, the patient, the staff, and our physicians as well.
So we have a variety of places patients can enter our healthcare system. Certainly, if you're simply concerned, we're going to be offering numbers where you can call and get advice about your symptoms. Those will be published shortly. You can contact us and get an appointment with any of our primary care physicians through our 606 docs number. That allows you to immediately have access in our clinics. We do have very short time frames to be able to get an appointment in our clinic. We do have urgent cares where you can access. And if you really are seriously ill and you're concerned that you have an emergency, of course, use our emergency departments. When you do present to those facilities, we ask you to call ahead. One of the things that we will either provide for you or ask you to do is put on a droplet mask, a simple surgical mask, if you are having symptoms of cough, cold, and fever that you're concerned about. That helps prevent the spread of infection, no matter what it is, whether it's influenza or a common cough and cold, to other people. And it protects healthcare workers, it prevents other patients that may be in the vicinity, protects other people you may be in contact with. But a variety of ways to access our healthcare system. We do have no problems with access. We have immediately available appointments at all our facilities, and we will be providing numbers. So if you just simply want information, you'll be able to get it from us as well.
So
If you don't have a mask, what option would they have? They don't have a surgical mask sitting around their house.
When you present, if you call ahead, we'll provide one for you.
if deemed medically necessary, how much will testing cost somebody?
Currently, all the testing is through the public health department. We are not offering through any commercial labs at this time any other testing. So we follow all CDC and public health department guidelines in getting those tests, and then those come through the public health department. So.
It's the same for the UT Health as well.
What's the current criteria? Is it just doctor's discretion when it comes to someone being tested?
Again, it's based on like what George just described. It's travel history, known exposure history, fever, cough, shortness of breath, and a few other less prominent symptoms. But it's basically this exactly what George just described, combined with travel, known exposure history. We do try and test for flu, influenza before we start talking about coronavirus, simply because the symptoms are very similar, and so we like to rule that one out first, and then it becomes a conversation between the clinicians and Net Health to decide if it's appropriate to go ahead and test for coronavirus at that point.
And really the only other category are those with severe pneumonia, where we look for certain characteristics. Those are what we're scanning for in emergency patients that are coming through to ensure that they have the typical characteristics that we can describe. There's certain lab tests and things that can lead you down the path of trying to diagnose it before you actually have a COVID-19 test available. Those are what we're using to provide to the health department so they have all the pertinent information to be able to help us make a decision whether COVID-19 testing is appropriate or not.
So are they going to receive a bill if they have to be tested?
Oh, for the CDC test kits?
For the CDC
That is provided by the
test kits,
CDC to answer
allowed?
that. To know that there may be a clinical fee, but there's not a fee for the test.
Right, that's correct.
Other questions?
Do we know if any of the healthcare workers who interacted with these three people, are they under monitoring or being tested?
I don't know. I'm looking at Russell on that one. I don't know the answer to that, Russell.
We don't have anybody under monitoring who is a healthcare worker. Individual agencies may have that in their policy, but is not a public health measure that we enforce. The folks who are taking care of these people are highly trained in donning and doffing of their PPE, and we assess that as a very low risk, although you do see a heavy impact in the profession, and is a major concern of ours that we flatten the epi curve so that we preserve these medical resources, whether it's a facility that these gentlemen work at, or if it's a physician or a nurse.
This is probably a question for both of you, but when it comes to your confidence in your respective hospitals' capacity to handle these situations, whatever it may hold, do you have any plans in place to bring in extra staffing, change people's hours, things like that? Are there any plans in the works or already done?
That's an ongoing conversation depending on what's happening at any given moment. If we have surges in activity, we would certainly move staff around to try and accommodate for that. There's not a defined plan because we don't really have a need yet, but that's something that myself and the HR folks and other leaders have a conversation about every day, is how we're doing on staffing. You know, as things change with public events being closed and potentially schools, et cetera, how are we going to meet the needs of our patients with staffing concerns then? So it's really more of a daily conversation than a set, here's how we're going to do it. We're going to have to be able to be flexible around what's happening in our systems, at least from our standpoint.
And I'll just say for Christus Health, we're having daily calls that are throughout all ministries. We're coordinating information about supply chain, about human resources, about adequate preparedness for protective equipment for our healthcare workers, medication, supplies, anything that we're concerned that we could potentially run short on, we're planning and preparing for. I think every healthcare organization in the country is doing the same thing right now to ensure we have adequate resources to be able to always care for our citizens and our patients and our communities.
Is there any chance of changing or modifying the visitors policies to the hospitals?
Again, from our perspective at UT, we are studying that daily based on what's happening in the communities. We are not currently fully restricting visitors in most of our facilities, but that is will be a consideration going forward depending on what we begin to see in our community and with our patients.
And we also are not currently restricting visitors, but you'll see signage in all of our facilities instructing people to be aware of the same CDC guidelines. If you've traveled to some place where coronavirus has community spread within the last 14 days, please be aware of it. Please try to maintain all precautions as far as hand washing. It's the same thing that's on the CDC guidelines right now. We want all of our patients and visitors to be aware of that policy to protect each other and our patients. As the situation changes and potentially we see community spread in the future, those guidelines may be revised, and we're continuously monitoring that.
I'd like to hear from the EMS representative.
John Smith.
As far as any extra precautions for your people who go out and might interact with the potential patients, what are the things they're doing that they don't typically do?
Well, the main thing is the equipment we would use. If they walk in, they see somebody with flu-like symptoms, a fever, a cough, they're going to be donning a N95 mask, which is a little bit higher grade mask they're going to wear. They'll be wearing a gown. And then they're going to go through the proper procedures to take that off and keep that clean. And we're also letting our first responders, our fire departments also know if we suspect that that patient could be contagious with this virus, that we're limiting the number of people that go in the house as well.
And your folks are told ahead of time before they arrive that
So we're screening the calls via the 911, and if the answers that they give us the heads up that this could be a potential, they'll come in with the case. Otherwise, we're asking our first responders to limit. The first person will go in and they'll talk to the patient, and as they talk to them and they see the symptoms, we'll go back out. We'll put on more gear if we need to. But everybody's on high alert. We're all looking for the right symptoms. We're all asking the right questions, and if any of those are checked, then we're going to limit the amount of people that go into the facilities. And we're also doing this for nursing homes and other facilities that house patients.
Were the 3 individuals transported by ambulance?
Not to my knowledge, no.
Yes, sir.
One more on the testing of these people. I know y'all are limited in what you can say, but has anybody that did not travel with them but spent time around them, maybe cohabitated, also tested and come back negative?
I'm looking at Russell. Russell Hopkins is shaking his head no to that.
So nobody that was around these people that didn't travel with them have been tested positive. So nobody's caught them.
Yeah, not to our knowledge at this point.
So can we say what region, like Asia, Europe, a cruise? Can we narrow that down any at all?
Again, I go back to the I'm sorry, it goes back to the privacy thing.
Outside of the continental United States?
Yeah, we said that. Yeah, we did say travel outside. We said the word recent travel history outside the United States.
Do we know when they returned, like within the last week, within the last 2 weeks, within the last month?
Russell shaking. I'll let you answer. I see you shaking your head.
So the question was, do we know when they returned from their international travel? And the person under investigation form does have that information. I unfortunately don't know the dates for these people.
Again, typically the typical symptoms arise 2 to 14 days after exposure. So that's going to be your 2 to 14 days is really the touch point there. So if you're exposed, you have the risk of being 2 to 14 days later have symptoms arise.
Do we know how long the time period was between arriving back at home in Smith County and being tested?
Do you know that?
I don't have that answer, but yes, we do know when they arrived and when they began to exhibit symptoms and when they reported to the hospital. I do not have that information with me.
Are you able to release that though?
I would not.
Did they come straight back to the United States, or were they routed through somewhere like Lackland?
The question is, did they go directly home or to one of the military facilities where people were quarantined? The answer is no, they did not.
George, that brings up another question. Do y'all know of any residents from this area who are currently being held elsewhere for quarantine? Are y'all informed of that? Like people put on cruise ships or something?
Yeah, so in the beginning, the question is, do we know of any other people who were being held outside of our community for isolation measures? And we do know some of them. We don't know their current status. The process would be to identify an arriving traveler from areas of concern across the world, and then they are presented with some questions as they come through customs control. That is sent to the CDC, it goes to the state, and then is funneled down to the local health departments. We have on occasion been told, you have people back in your community, here's their phone number, and we've called them and they are actually on a cruise ship in Cambodia. So this is the reason why we're always reaching out to them early and quickly. We called them before they could even get back to our community. So they had decided that they would self-isolate on that ship rather than come back and start their 14 days over again.
Has Net Health talked to the local ISDs, and do you have any suggestions for them?
Yes, 3 weeks ago, met with the Smith County superintendents. I also have an appointment this afternoon to do the same. In that time, we talked about how their sanitation hygiene practices could be bolstered and how attendance and distance learning, if possible, would happen. Today's meeting, we'll be discussing the guidance from CDC on closures and delays in schools and minimizing those congregate settings.
So we've got 3 in Smith County, 1 in Greer County. Do we have any other positive cases in surrounding counties in the health services?
Not in my services.
Were the 3 patients ever under self-monitoring ahead of the test?
They were under medical monitoring.
Before ever coming down with symptoms?
No. Other questions?
Other questions? Mayor Hines.
Okay. Thank you. I thought it was very important today to make sure that we had so many of the professionals in the room to discuss about all the preparations that we have made for this day coming. And as we've watched, everyone watches TV, so we see that this has been occurring all over the country. And I just want to thank all the professionals. I know that we are prepared in this community. And it's something that I had a question by media yesterday. Y'all asked me if I was nervous. I'm not nervous. I know the quality of work that has gone and preparation that has gone into this. I'm not nervous for our community. I do think we all should just be able to relax and pause for 2 weeks at a time. And then let's just make sure that we're doing what the experts are telling us to do, some of the social distancing, not to congregate in large crowds, and to make sure that we're contacting the health professionals prior to going to their facilities. So, but we do want, if someone is feeling ill in the community, make sure you're reaching out, please. Call these great professionals we have here. They care for the outcome that you're going to have. And I know the people of Tyler, and I know the people of East Texas. We do so well at caring for one another. So let's just all make sure that we still have that spirit and that we're all talking to one another and making sure that if you feel ill, have some help. And one thing I don't think they talked about today, but I mean, how many times have we seen it on TV? That it's disproportionately affecting the elderly population. So I know they've worked really hard with the nursing locations in town, all these entities have. But let's just make sure that we're just cautious as family members, right? When you're interacting with grandma and grandpa, we always have them in mind. And so we're going to be great through this. This is just a short blip in all our lives, right? That we're going to be able to move past this. And I'm comforted to know that these professionals are doing so much and so prepared for this. And so let's all do the best we can. Let's don't be nervous. Let's be cautious. And we are prepared in this community to help anybody that has questions. We have great professionals here. So again, thank all the professionals for being here today. And I know you're taking time away from your busy efforts on this, but I think it was very important for all of us to come together today to express the great planning that we've all done in the community. So now we will go forth and take care of people in our community and just make sure that you're calling hospitals, doctors, washing hands, and all that wonderful thing that they described today. So again, thanks to everybody that's here today and for the media to be here to discuss it with us. Thank you.
Mayor, at any point, do you anticipate
Sure.
Any similar action to what happened in Dallas County yesterday with a public gathering and momentarily?
Well, we announced that yesterday, right? That we were cutting back on several events in the community for the next 2 weeks that are at the city facilities. I believe each entity, I think Texas College has had an announcement, TJC, UT Tyler, school superintendents are meeting today, the county. I mean, there's going to be a lot of that occurring. And we talked about some of the major issues, but I think what you'll see is all the institutions in the community talking about how it's best to interact with city staff. We'll be coming up with that. And I think the same will be true with the county will also have some discussion. So I think there'll be a lot of information, and we really will be putting the information out on those changes, but we really count on our media partners to make sure that all that information goes out to the public. But just like I said yesterday, I mean, we're looking at 2 weeks at a time at the city as we go forward. For me, for example, I'm going to have some alone time in my office working on spreadsheets that I haven't had for years. And so, I mean, if you have a good book that you want to read and catch up on, do that. If you want to, there's some people that are going to want to do genealogy. This is a great time to be in front of your computer and just really enjoy some of that time, and also with your family. And then this will be just a blip in time, and we're all going to be just fine. Okay, but thank you very much for your interest and communicating to the public what's going on. And again, I'll just end. I've thanked all our great healthcare institutions and the Northeast Texas Public Health, our first responders, And I'm just going to end with that. We have they're incredible people in this community, and we're just really very fortunate and blessed to be in a community like Tyler in a time like this. So thank you very much for coming.
Thanks.